Charlie 16, ambulance 4, medic 3, respond priority 1, 100 Grockmall Avenue for an auto accident. Caller states subject is trapped inside the vehicle and has severe lacerations. Units responding handle code 3.
I really wanted you to see Court Square and these beautiful buildings. This is Symphony Hall, just gorgeous. They have a lot of fine entertainment here, and I don't remember the name of that building.
Campanile.
The Campanile, right.
Campanile.
That's the Campanile.
Sure.
Isn't that gorgeous? And this is City Hall, one of the most beautiful structures, you know, in the entire Commonwealth. It's just gorgeous architecture. And behind those trees is the Civic Center, and that's the home of the Springfield Indians, the Calder Cup.
What's the matter? Call 911. Get an ambulance. Go around the corner. Are you all right?
Springfield Police Emergency.
Hello, my friend's having a heart attack.
Your exact location, please.
We're in front of the City Hall.
Okay, we'll send someone out.
Charlie 2 Alpha, ambulance 12, medic 1, respond priority 1 to City Hall, the front of, for a possible cardiac arrest. Caller states subject is unconscious on the steps. Units responding handle code 3.
To the ambulance.
You know who found him?
The collapsed on his wife.
How old is he, ma'am?
71.
71.
Yes. The shirt open a little more. Hold on. You still don't have a pulse. So you still no pulse? Excuse me? Do a quick look. Daisy fib. Charging 200 joules. Start charging. Okay, clear. Clear. Okay. Got pulse? No, I don't have pulse. Charging 300 joules. Charging. Everybody clear? Clear. Okay. Pulse? No pulse. Okay, one more time. Charging at 360 joules. Everybody clear? Clear? Pulse? I still don't have a pulse. Mike, I'm going to go ahead and drop the tool. There's your fluid. Similar idea. Get a light strap, okay? Okay, tube's in place. That's good press down. There we go ahead with the first deputy on the tube. Bag's plate. We got the IV started. Okay, we got the IVs running. If he's down the tube, I have one sharp landing. You want to check another pulse, please? Okay, we still no pulse. We're gonna charging at 360 again. Charging. Everybody clear, clear. Pulse. I've got a pulse. Let's get him packaged. Let's get out of here. I'm gonna secure the tube. No sign is Brady at 40. Okay, let's go to the base state with them, Mike. Tube is secured. Okay. Ready to roll. Forward. Okay, we're gonna put on forward. Okay. Ready? On to 3. Head on 3. 1, 2, 3. Back. Count to 3 up a little bit. 1, 2, 3. Okay. Go grab the start. 2 quick. Ready. 1, 2, 3. Seatbelt gonna fit over that? My left, wrong side, Gonna go up? Okay, stairs. Where are you gonna go with the car? On the inside? We'll drive you first. What's the pressure? 80 by 12. 80 by 12? Thanks. Okay, we're all set to go. Tell you guys are ready. Okay. All set to roll.
Yep, ready to roll.
Okay, ready to roll?
Yep, all set.
Springfield CMED, Springfield EMS, requesting a priority 1 patch to the Bay State Medical Center.
Stand by, I'm Med 1. Springfield CMed calling Bay State ER.
This is Springfield ER. Go ahead.
This is Springfield EMS, paramedic number 2. Could I have a signal 600 for cardiac arrest, please?
Stand by, please.
Bay State ER, MD8, go ahead.
This is paramedic number 2, currently en route to the facility with a 62-year-old male patient. Bystanders state clutched his chest as he was walking down a flight of stairs. Bystanders went on to state that the patient from there slowly deteriorated. Upon arrival of the police department, the officer determined the patient was apneic and pulseless. CPR was initiated by the police. Upon our arrival, the patient was in full cardiac arrest. A quick look showed the patient to be in V-fib. We shocked the patient 3 times with no change in rhythm. The patient was shocked at 200, 300, 360 joules. He was then intubated and IV therapy was initiated. We administered 1 milligram of epinephrine as CPR continued. Following the medication, we defib the patient at 360 joules. Patient went into a sinus bradycardia rhythm with a pulse. Heart rate was 40 with first-degree block. Blood pressure is now 80 by palpation, and the respiratory rate is being assisted. I'd like to administer 1 milligram of atropine to bring the patient's heart rate up, followed by a saline bolus of 250 cc. Our ETA to your facility is approximately 8 minutes.
Go ahead with the atropine and the saline bolus, and be prepared to pace the patient if you need to.
Receive Metcon. We're going to administer 1 milligram of atropine IV push, followed by a saline bolus. If no change, we'll consider pacing.
Base state clear.
Thank you, Bay State. Thank you, Springfield CMed. Springfield EMS is clear.
Paramedics are trained professionals that bring the emergency room to the streets, saving lives, as time is the ultimate enemy.
How's that? Does that look pretty good?
Well, it's better than last time. It's 138 over 88.
Springfield College, in association with Bay State Medical Center, trains paramedic students in all aspects of emergency medicine. Hospital rotation provides hands-on training, experience in the administration of medication, and the learning of procedures. Dr. Kim Craw is the medical director of the Emergency Medical Services at Springfield College. His role is to ensure the best education possible for the emergency medical technicians.
It is the hope that these specialties can pass on an education to them so that it's not only an education that they receive in the classroom, but integrated with the hospital and in concert with the experts in the field, so that they will be able to professionally perform the same procedures in the same manner that the experts do.
Dr. John Santoro is Chief of Emergency Services at Bay State Medical Center, where he oversees the daily operations in the emergency department.
It used to be more of a load-and-go type attitude. Now it's an extension of the physician in the emergency department, an extension of his eyes and ears and hands out into the field, into the community. There are a lot of medical conditions where time is absolutely essential. So if we as emergency department physicians can't get to the patient, then we can get medical care delivered to the patient by the paramedic.
The paramedics allow us to do even a better job. There are a lot of times where I, as an emergency specialist, have patients coming in that were dying out in the field, dying in their own home of anaphylaxis, of asthma attacks. And by the time they came into the hospital, they were comfortable, talking in full sentences, and actually wondering why they were in the hospital. That's a great source of pride to me.
When you see VFib on a monitor, it looks just as chaotic on the monitor as it does like in the real chest. So if you open somebody up, it's a big bag of worms just sitting right there. It's not contracting, it's just fibrillating. And that's what it looks like on monitor, and that's what it looks like inside.
At Springfield College, students acquire the basic knowledge of emergency medicine. The 4-year curriculum focuses on classroom instruction, sometimes conducted by doctors from Bay State Medical Center.
The PR interval is what? Doing what?
The PR interval is getting longer.
And then what happens?
So it eventually drops the beat.
So what is that?
It's a winky back, moments one.
All right, exactly.
Utilizing an array of teaching methods, the student learns skills and procedures. Paramedic students are then evaluated on the basic medical procedures.
Okay, Phil, you ready for your scenario?
Yes, I am.
Okay, you've got a 50-year-old gentleman that was out working in his yard. It's summertime. Wife looked out as the patient clutched his chest and collapsed. You're the first crew on scene.
I do a quick assessment, airway, breathing, circulation.
Okay, he's apneic and pulseless.
Okay, I do a quick look on the monitor.
The young men and women who do this job now are true professionals. They're the people who go to school to learn drug dosages. They learn to interpret EKGs. They learn a lot of medicine in a very limited scope. Their forte is resuscitation. Their forte is to be able to work without orders from the doctor now. They are operating what we call standing orders. They are trained enough to be able to interpret the rhythm of the heart, to give appropriate treatments and medications, and to operate essentially independently under certain emergency circumstances. In addition to classroom, we also have an extensive clinical phase and a field internship where the paramedic students actually perform as paramedics under the tutelage of more experienced paramedics called preceptors. We are almost the sole provider of EMTs and paramedics in the greater Springfield area. But more importantly, we are training leaders for across the country, and as a matter of fact, internationally. We have students from Puerto Rico and from Taiwan who have entered the 4-year program here. So we hope to export our knowledge of this new science throughout the country. It's very crucial. The first minutes of an incident are paramount to the patient's survival. And so the earlier you can get advanced life support out to the patient, the better the outcome is going to be for success.
Another part of paramedic training is to participate in exercises with other rescue personnel. This drill was conducted at the Fire Training Center in Indian Orchard.
Two-car vehicle accident. We have two persons trapped in the vehicles. Will you start the rescue squad, please? Unconscious. One person's conscious. Doors open over there. Revving of engines. It's just going to be, you're going to be cutting the window open. stick.
Can you hear us, ma'am? Can you hear us, ma'am?
Got oxygen if you want it.
Yeah, let's get her on 100%, please.
Hey, it's on.
Okay, I got one line in.
All right.
It's running wide
High-tech,
open.
whoever's spiking another bag out of our orange kit, please. What do we got, lactated running? I want lactated, please.
We got LRs here for you.
Okay, give it to me on this side. I also need a 14 or a 16 out of the bag, and alcohol prep and a Venagard.
Sure. Best bus is 90 over 60.
90 over 60, cool. Got it?
Yeah.
Cool beans, cool beans.
Deep breath again.
Ma'am, you're gonna feel a very big stick in your hand here now. Hold still. Beautiful. All right, good deal. We got 2 lines going. You got a pressure yet?
We got a pulse right now about 120.
120. Okay, let's just get the monitor going.
All set? All right.
That was all set?
Why don't we put the monitor on her in the truck?
Okay, let's go.
What'd you get?
What do we got for pressure?
Okay.
And it's not taped. We want that tape before we get her in, all right? On 3. 1, 2, 3. Okay, just up here on the top.
As part of the emergency medical program, the students travel to New York City to participate in a week of training with the city's emergency medical system, which responds to over 3,000 calls a day. This innovative program offers the students daily life experiences where they can practice their skills and become acclimated to the advanced life support element. Here, the students travel to Fort Totten for orientation.
Welcome to New York City. You're all going to be assigned to one specific unit in various parts of the city. The 5 boroughs in the city, you will be encompassing 4.
They're getting first-hand knowledge in not only the medical situations, the cardiac emergencies, but also the trauma situations, where we would involve all of our advanced life support skills, including endotracheal intubation, cardiac defibrillation, starting IVs, large bore IVs for quick transfer of body fluids. They'll be utilizing our telemetry system, coordinating the biotelemetry feedback to the various participating hospitals and also our medical control, and communicating their findings, their initial evaluation of the patient, assessment, and their actions up to that point requiring additional medical input. So there's a full gamut of ALS skills that they'll be putting to perfect practice every day they work out here.
Is that another ambulance? I'll get another one. We got another one coming. Make room. We're going to do 2 in here. We got another one on the back. Just bring them up. Okay. Still pumping air and breathing. Good. Right, it's fine. He's breathing. Yeah, they're both breathing. Stay back. Yeah. All right, not going to do them yet. Portable tube. It's on. We don't have any more here. We got another one. There's only one? All right? This kid's in a rest. Back up, okay? Back up, okay? Come to the front of the building. Come to the front where we're staged, okay? We're working 3 patients here. We gotta get that rig. Right here. Hey, hey. Need somebody inside. I got the end. Let's go. 1, 2, 3. EMS is here. I'm going to have EMS jump in with you, Phil. Okay, we're out of here. All right. The drug box, I'm leaving here. Check the firefighters. I'm taking this kid. No, I want a spine board. I'm bringing my. We're going to do extra. Spine board. A spine board. Hold the spine board up. All right, Keith, I'm with South Hadley. You're with, stay with that. You're with that. Stay with that. You want to set up in South Hadley? Yeah. Keep breathing.
The paramedics in Springfield supply professional medicine with empathy, the kind of medicine that cannot be found anywhere else.
What the paramedics provide is a level of insurance or security that should something bad happen, and no one can say that it's not going to, that they'll be there and they'll be ready to intervene. There are a lot of medical conditions where time is absolutely essential.
What we were doing is bringing the emergency department out to the streets of Springfield. And this is an advantage that some cities and towns still don't have in the 90s. And that's part of our mission at Springfield College, is to try to train locally and nationally so that the best medical care can be available to the citizens.
The paramedics carry life-saving medicines. They carry with them life-saving skills that only they can perform.